Tom Boyer, Chalk Creek Boars, talking about disease management in goats. As goats were originally bred and prepared by nature for our environment, they were originally intended to be out on the native ranges and to browse the grasses, the pastures, the rangelands, and they enjoy particularly woody, herbaceous forbs that turn into browse, we call it, later in the plant cycle. Goats often, and with preference, is to eat over their heads. And so these are all things that are helpful in determining what they're going to move into and by way of disease management, because as we bring them in, change those diets, we begin to get different diseases. One of those diseases is polio. Goat polio occurs when the goats get too much concentrates, which bind up different elements in their system and cause them to wander in a circular fashion and act like they're drunken. Polio can be treated with thiamine injections, penicillin, and other regimens that you can determine from your veterinarian. But those two items are particularly effective in treating goat polio. One of the more common ones that we have incurred by bringing our goats in from the native ranges and outside pastures into confinement is pneumonia. Pneumonia occurs when we bring the animals in and they don't have adequate ventilation. Occasionally they'll get pneumonia out in the open as well, as dust or other items will cause them to get it. Pneumonia can be treated with a variety of drugs, and again, those are best selected from your veterinarian. But some of the new drugs that are very helpful in this regimen are Draxin, which is a very expensive drug but also a very effective drug, and others include Nuflor, and in some cases penicillin can be used in combination with those, but those are effective drugs in helping control pneumonia.